Do you feel anxious frequently?
All the time. I'm a really anxious person.
Do you like that?
No, I hate feeling anxious. I'm just not sure what to do about it.
My guess is the coping skills you've used in the past aren't as effective for this.
That's the thing, is that I'm anxious enough as it is. I just can't waste the anxiety calories on, you know, before the baby.
Is it possible, though, there's another strategy? Because the strategy you're talking about is called experiential avoidance, which is, I don't want to feel that anxious.
Right.
So instead, I won't think about it.
Dr. Ryan Fuller is a clinical psychologist who specializes in anger management. He says celebrities with anger issues, like Chris Brown, have a more difficult time than a typical client.
They don't get to let go of it. It gets framed in all kinds of ways from all kinds of people, and for whatever better or worse, they're going to have to learn to deal with it a lot differently and probably at a much higher level than the rest of us.
When you're looking for a space, analysts say you're often already on edge, like a hunter.
Obviously, they're making it much bigger than it is. But once they're there, one of the things that goes along with anger is that there's oftentimes a righteousness. I'm just, I'm in the right, and so in that case, there's no reason to measure my response.
You say if something does happen, let's say there is some kind of confrontation or something is said that really burns you up, take a moment, right?
Yeah, I mean, it's very important to realize that we have the right to disengage, and it might be really a good idea to re-engage once our sort of temperature comes down, but staying and continuing the cycle of ratcheting it up isn't going to be helpful. So step away, take a few breaths, cool off, and then come back.
Hi, everyone, and welcome to Katie's Take. I have a feeling this is going to be a very popular episode because we all have bad habits.
In terms of looking at the behavior, there are usually two things to pay attention to. The first are the outcomes. So it could be a particular medical outcome, or it could be a behavioral one. In the case of procrastination, am I missing my deadlines? Am I causing interpersonal conflicts with my coworkers? And then the second piece is the function. We want to make sure that if I'm choosing to eat dark chocolate or to have a cocktail, that it's really about enjoying that, about the pleasure and what I'm approaching, and not about sort of avoiding and putting off feeling anxiety or worries.
Clinical psychologist J. Ryan Fuller has never treated Congressman Weiner, although he spoke generally about people in his position, people of power who abuse it.
One in the public eye who has been exposed at doing something they've tried to cover up is likely experiencing feelings of, high anxiety and distress and potentially shame or even guilt. Powerful men may be more susceptible to cheating in that they have a tendency to be traveling more, they're outside of the home, so they might not be as closely monitored. They're going to have more exposure to opportunities. It may be that because of their status, they're going to be viewed as more attractive. They're oftentimes surrounded by sort of yes men, and so the idea to them that what they're doing is wrong or that they'll get caught may not even enter into their minds.